Hi everyone, today I shall discuss about the surface working of the head and neck region. That means the surface working of face and the neck. The surface working is very important, I tell everyone, because through the surface working you can assess the region where actually the tumor, where actually the sinusitis occurs in the region. That's why we can examine the patient through surface working. Now for surface working of the face and the neck, we should use some points and some lines. What are the important points are there? The points are, that is, one point is at the nasal. Now what is nasal? You know, in the nasal there is the junction of the frontal bone with the nasal bone. So this is actually the nasal. Next, you will see why this nasal is important, because from the nasal to inion we can measure the length of the skull. Not only that, from the nasal we can draw the frontal ear sinus. How we can draw? 2.5 centimeter above the nasal, you give a point. Then you will give the another point at the junction of the medial 1/3 and the lateral 2/3 of the superciliary arch. Now it is over the eyebrows. Now always you tell the subject to close the eyes, otherwise the eyes will be, there is a problem in the eyes. Now connect these 3 points by means of small card. So this represents the frontal ear sinus. You see, the frontal ear sinus, usually it is more prominent in case of male, and you will see here not only it is prominent in case of male, you will see this superciliary arch is also prominent in case of male because of the large frontal ear sinus. But there may be the difference also. Now, next thing I will draw, that is a point that is known as the facial artery in the face. Now, the facial artery in the face, the first part of the facial artery is tortuous. So, where I will give the first point I will give it, that is the anterior-inferior angle of the masseter, which is, that is, you can feel, this is the mandible, then this is the masseter, and this is the anterior-inferior angle of the masseter. Then you will put the point, this is the angle of the mouth. From the angle of the mouth, that is 1.2 centimeter away from the angle of the mouth. And next, you will see the third point in the medial angle of the eye. Now, you join this point. Actually, the first 2 points you will join in such a way so that there are some amount of tortuosity, because the facial artery is tortuous in the lower part. Why the facial artery is tortuous in the lower part? You will see, because the facial artery, when the movement of the mandible occurs, then it will stretch. That's why this lower part is tortuous, and upper part you will connect by means of 2 straight lines. So this is the facial artery in the face. You will see. So this facial artery is also known as the anesthetic artery, because the anesthetists, they actually stand at the head end of the patient and they feel the pulsation here, so that it is also known as the anesthetic artery. So this facial artery is very important nowadays, because there are face lifting and their cosmetic surgeries are there. That's why it is very important. Now the third important line which I will draw, that is the parotid duct. Now for the parotid duct, you should choose a point. This region is known as the concha. So first point is you will give in the region of the concha. Then the second point you will give between the ala of the nose and the upper border of the lip. That is the vermilion border. So join these 2 points by means of a line. So this is a line, and that is also another line. So the parotid duct is not extend through and through. You actually take only the middle third. So this portion I will omit and this portion I will omit. So this is the parotid duct. In this region it pierces the buccinator muscle and it goes into the upper second molar teeth, vestibule of the upper second molar teeth. So this is the parotid duct. So this is very important. Why it is important? Because when there is stone in the duct, one can feel in this region and palpate the stone. Next point that is important too, that is the actually the you put your point in the hyoid bone. So before that, the prominent thing is that you know this is the Adam's apple or the laryngeal prominence. So put a point over the laryngeal prominence here, and above that laryngeal prominence, if you can feel, so this is the hyoid bone, the greater cornu of the hyoid bone. I will feel it here. So this is the position of the hyoid bone. Hyoid bone, if in this region you can press it, then you will see there is throttling. Next you will see this is the thing that is the thyroid laryngeal prominence. Now draw the give a point over the isthmus of the thyroid. Where you will get for the isthmus of the thyroid? You will see this is the cricoid cartilage. So you will get this cricoid cartilage, and above the cricoid cartilage will give a point that is below the cricoid cartilage, that is 1 centimeter below the cricoid cartilage. And you join this point by means of quadrilateral line and this indicates the isthmus of the thyroid gland. So why it is important? Because you know that when there is tracheostomy, that means the emergency service where the respiration is stopped, then you will do the tracheostomy. So if you do the mid-tracheostomy, you have to go through the isthmus. But if you have got time, then you can actually pull off the isthmus and then you can do the tracheotomy. So this is why this is very important. Next thing is you should know where the spinal accessory nerve goes, because you know during the biopsy of the lymph node, as it is a superficial structure, sometimes there is cutting of the spinal accessory nerves. How you can locate the spinal accessory nerve? You will see, give a point in the region of the tragus. Now next point you will see here, This is the angle that actually this is the ramus of the mandible. You can see the prominence, and this is the anterior border of the sternocleidomastoid. So you will put a point near this where that you will see the transverse arch of atlas you will get. Then the point is, this is the sternocleidomastoid anterior border at the junction of the upper 1/4 and the lower 3/4 of the anterior border of the sternocleidomastoid. Next you will see the next thing is you feel this is the posterior border of the sternocleidomastoid at the junction of the lower 1/3 and the upper 2/3. You will give a point. And the last point is actually in this region, that is above the clavicle, 6 centimeter. So I will draw this one by means of a single line because it is a nerve. That's why I am doing the single line. So this is the spinal accessory nerve. So mind it as it is in very superficial in this posterior triangle. When there is lymph node biopsy, one should do meticulously. So this is this nerve you should know. Another thing is the common carotid artery. Common carotid artery, you will see, you feel this is the thyroid cartilage, this is the thyroid cartilage. And by the side of the thyroid cartilage, if you feel, you can get the arterial pulsation. So where you get the arterial pulsation, at that point will give a point which is the anterior border of the sternocleidomastoid. And another point is at that is the sternoclavicular joint, this one. So if you draw these 2 points by means of 2 lines, this is the common carotid artery. So common carotid artery, there is the angiogram, then you can do the common carotid artery. So you have to know this surface thing. So thank you everyone for watching this video.